Welcome to The Growth Kit, a podcast where science and actionable advice intersect to help you live a better life. 21 caffeine myths, heart health, dehydration, lethal doses, and more. Caffeine is the world's most widely consumed psychoactive substance, yet it's also one of the most misunderstood. From its effects on heart health to myths about dehydration and the elusive lethal dose, misconceptions about caffeine are widespread. In exploring these 21 common misunderstandings, much of the information presented draws heavily on a comprehensive review published in the Journal of the International Society of Sports Nutrition, highlighting the complex and nuanced relationship between caffeine and our health. Without further ado, here are 21 myths about caffeine. When is it best to stop consuming caffeine during the day? Most recommendations are to stop drinking after 3 p.m., but while the peak effect of coffee is an hour after the sip, the half-life of coffee is 5.7 hours. The average coffee drinker has about 24 ounces of coffee a day, which contains about 270 milligrams of caffeine. That means that if you finish this cup of coffee at noon, then half of that caffeine amount, 135 milligrams, would still be in your system at 5:30 p.m. At 11 p.m., there would still be 67 milligrams of caffeine in your body. This is like drinking 2/3 of a cup of coffee an hour before midnight. While 5.7 hours is the average half-life, a slow caffeine metabolizer can have a 10-hour half-life, and a fast metabolizer can be just a few hours. 2. Does caffeine work for everyone the same way? No. Individual responses to caffeine vary significantly. While most people benefit from caffeine's performance-enhancing effects, a small number may not respond. 3 is also a spectrum of metabolizers, as some are slow and some are faster metabolizers, which explains why my wife can have an espresso after dinner and fall asleep without a problem, while I have trouble falling asleep if my last sip was at 1 p.m. 3. Does caffeine stunt growth in children or adolescents? There is no scientific evidence indicating that caffeine consumption impedes growth in young people. Concerns about caffeine affecting calcium absorption have been largely dispelled, as current research shows that moderate caffeine intake does not significantly alter bone health or growth patterns. 4. Does delaying caffeine intake after waking, less than 1.5 hours, prevent an afternoon energy drop? There is no evidence that delaying caffeine consumption after waking prevents or reduces the likelihood of an afternoon energy slump. The afternoon crash is more related to overall sleep quality and daily energy patterns rather than the timing of caffeine intake. 5. Does decaffeinated coffee contain no caffeine at all? Decaffeinated coffee still contains a small amount of caffeine, approximately 2 to 5 milligrams per cup, compared to about 95 milligrams in regular coffee. While this amount is relatively low, it contributes to the overall daily caffeine intake and can be significant for those highly sensitive to caffeine. 6. Does caffeine help with weight loss and fat reduction? There's no consistency within the literature to support this. Since weight loss is so complex and relies on many things working congruently together, it's difficult to study. 7. Should pregnant women avoid caffeine entirely? Most research indicates that high caffeine intake during pregnancy is linked to negative outcomes, such as miscarriage and low birth weight. Pregnant women are advised to limit their caffeine intake and seek specific guidance from their healthcare providers. 8. Can caffeine affect mental health or depression? Moderate caffeine intake might temporarily improve mood and alleviate some depressive symptoms, but excessive consumption can worsen anxiety, disrupt sleep, and lead to other negative mental health effects. Is caffeine harmful for those with anxiety? For some individuals, especially those consuming high doses, caffeine can worsen anxiety symptoms. The effects vary greatly between individuals. Some may tolerate caffeine well, while those with anxiety disorders might find it beneficial to reduce or avoid caffeine altogether to manage their symptoms more effectively. 10. Does caffeine enhance cognitive function effectively? Caffeine is known for temporarily boosting alertness and cognitive performance. Although it can improve focus and reduce fatigue in the short term, its effects are temporary, and over-reliance on caffeine can result in reduced effectiveness and potential dependency. 11. Does caffeine contribute to heart problems? Caffeine's impact on cardiovascular health is influenced by the amount consumed, duration of intake, and individual factors like metabolism. Moderate caffeine intake, often from coffee with known health benefits, does not show consistent evidence of adverse effects on heart health. According to research, current guidelines, such as those issued by the FDA, generally consider a daily caffeine intake of up to 400 milligrams as safe for most adults. Nevertheless, the need for personalized risk assessment cannot be overstated, especially among populations with pre-existing cardiovascular conditions or heightened susceptibility to other CNS stimulants and/or pre-existing, but otherwise unknown, CVD. 12. Does caffeine dehydrate you when you're at rest? Consuming around 250 to 300 milligrams or 3 milligrams per kilogram, considered moderate caffeine intake, does not significantly affect hydration levels in people who consume caffeine regularly. However, consuming over 500 milligrams or 6 milligrams per kilogram might temporarily increase urine output. 13. Does caffeine lead to a loss of bone mineral density? The research isn't clear on this. What has been found is that drinking up to 4 cups of coffee daily, about 400 milligrams of caffeine, might raise concerns about bone density and fracture risk, especially in women. 14. Does caffeine dehydrate you during exercise? Not really. While caffeine is an effective performance enhancer, dehydration issues are more likely related to overall fluid management rather than caffeine intake alone, although factors like sweat rate and genetics also play a role. 15. Can caffeine cause high blood pressure? Caffeine can cause a short-term rise in blood pressure, especially in individuals not accustomed to regular caffeine consumption. However, there is no consistent evidence that moderate caffeine intake is linked to long-term hypertension or an increased risk of cardiovascular diseases in healthy individuals. 16. Does caffeine consumption affect fertility? Moderate caffeine intake is generally considered safe for most people, including those trying to conceive. However, some studies suggest that high levels of caffeine, over 300 to 400 milligrams per day, might be linked to a slight decrease in fertility for both men and women. It's advisable for those trying to conceive to moderate their caffeine intake and consult a healthcare provider for personalized advice. 17. Are there differences in how caffeine affects men and women? The research is mixed. Caffeine generally boosts performance for both genders, and the placebo effect can improve sports outcomes. However, some studies suggest males may experience slightly greater benefits. 18. Does regular caffeine consumption affect how you respond to a single dose of caffeine? Habitual caffeine use does not negatively impact the benefits of an additional caffeine dose. To enhance performance, a dose of 6 to 9 milligrams per kilogram may be needed. I used to lower my caffeine intake for 1 to 2 weeks before competitions to maximize the ergogenic effect of caffeine, but it turns out that that is not necessary. 19. Does caffeine impact upper body versus lower body strength differently? It depends on the study, but not really. Overall, the evidence indicates that caffeine's benefits are similar for both upper and lower body strength. 20. Can consuming too much caffeine be fatal? While fatal caffeine overdoses are rare, they can occur in extreme cases. Such instances are unusual for healthy individuals who typically consume caffeine in moderate amounts through beverages like coffee or tea. According to this research, due to its broad presence in the food supply, The Food and Drug Administration, FDA, has recommended a daily limit of milligrams, or 0.4 grams. Further, the FDA estimates toxic effects, like seizures, can be observed with rapid consumption of around 1-200 milligrams of caffeine, or 0.15 tablespoons of pure caffeine. 21. Is caffeine considered addictive? Caffeine can lead to dependence and withdrawal symptoms, such as headaches and irritability. Although some consider it addictive, it does not fully meet the criteria for substance use disorder, and its addictive potential is distinct from that of more severe addictive substances. Thanks for tuning into the Growth Kit podcast. If you enjoyed this episode, please subscribe and leave a review. You can check out my website at mindbodydad.com and subscribe for more weekly insights sent to your inbox. You can also follow me on Instagram and Twitter at mindbodydad. Many of the links I share are affiliate links, which means I earn a small commission if you purchase through them. This doesn't affect the price you pay, but it helps support the podcast. In some cases, I may even be able to provide unique discounts for you. I only recommend products and resources that I genuinely believe in and use myself. My top priority is to provide practical ways to help you live better, and I wouldn't link to anything that doesn't align with that goal. Thanks for your support.